Welcome to video lecture 2, where we're going to talk a little bit about the Great Depression and its relationship to contemporary social policy. One of the expectations for this module is that you're going to watch Hard Times, which is a segment from Canada, A People's History. I'm asking you to for sure watch the first sort of 53, 56 minutes of that recording. But, it's an hour and a half long, and if you have a bit of time, it's well worth watching. But in particular, I want you to focus on the Great Depression and some of the early remedies to the Great Depression that were implemented in Canada. The Great Depression resulted in a decoupling of the association of morality and poverty in a Canadian context. As we learned in the previous lecture, the British Poor Law established a close connection between an individual or family's morality and their experiences of poverty and unemployment. But the 1929 stock market crash and the resulting poverty and unemployment and homelessness that resulted really challenged the understanding of this connection. The Great Depression was made more complicated by severe weather conditions that resulted in the loss of wheat crops and cash crops across North America. So in a Canadian context, our West Coast strawberry crops and our prairie wheat crops were killed by severe drought. We also had a series of dust storms resulting from the severe drought that removed and eroded topsoil from farmers' fields and also wreaked havoc on people's health and well-being. At the time of the Great Depression, Canada had no universal healthcare program, and so communicable diseases like TB were rampant. People living in shelters, unsanitary conditions, and crowded housing with little heat and little light experienced TB frequently. And if you know anything about TB from working in a shelter or institutional care setting, you'll know that it's a very debilitating illness that often leads to death. So the presence of these kinds of communicable diseases like TB meant that many people were unavailable to work or had difficulty maintaining work. These experiences were, in a way, universal. So mass numbers of the population experienced unemployment, poverty, and health crises. And as a result, these conditions challenged the understandings that we had about the reasons why people experience poverty and resulted in the population demanding support from government and asking government to intervene in the economy and to redistribute wealth. Despite some shifts in attitudes around poverty and unemployment, the notion of the deserving and undeserving poor was still very much alive in the era of the Great Depression. For example, families were more likely to receive relief in the form of food and clothing, shelter, money or vouchers to purchase groceries. Single men were deemed to be the undeserving poor, and they were often placed in work camps where they were forced to build roads and do other kinds of heavy farm or industrial work for very low wages, only about 20 cents per day. Rural families often had to come to the cities in order to seek out support and resources, and thus they abandoned their land and belongings. And it's my understanding, if you go to Saskatchewan, you can see many abandoned farmhouses that still exist on the landscape where people left them during the 1920s. The lack of healthcare meant that available doctors provided by government to support poor people often had massive waiting lists and patient rosters of around 2,500. The poverty and hardship experienced by large numbers of citizens resulted in a lot of social unrest and demands by groups of citizens. The work camps that were originally produced to engage in social control of single men actually ended up being the breeding grounds for a number of protest movements, as you saw in the film or will see in the film. The government had to rethink its approach to policy, and they began to introduce new policies encouraged by what's known as the New Deal activities of the US. And basically, that was mass infrastructure development and building that the US government undertook to build things like the Hoover Dam. So, great big massive infrastructure programs that would produce goods for the whole community, but also would generate a lot of work. So the government began to introduce things like mother's allowance, child tax benefits, and pensions. And so this really was the origin of some of the programs and services that we enjoy today. There's many an economist who will tell you that the best way to improve the economic outlook of a country is to start a war. And so World War II was essentially the end of the Great Depression. Many people were enlisted or conscripted into military service, and the need for munitions and other supplies meant that many women went to work in factories with few men available to do that kind of industrial labor. There was a sense of shared sacrifice during the post-war era when citizens were encouraged to think about a shared sacrifice resulting in a shared benefit. Sacrificing perhaps your own freedom or your own desires in order to protect everyone from the tyranny that the Nazis were inflicting on Europe. So this attitude began to shape the expectations of citizenry. And we saw things like benefit packages such as WSIB, universal health care, unemployment insurance develop as a result. And so in the post-war era, we often talk about the era of expansion of social policy and services in a Canadian context. The post-war era of expansion ended in the 1970s with a global oil crisis, high inflation, high interest rates, and high unemployment. The good times were over, and governments were trying to figure out how they were going to pay for all the promises that they made. And so there was a general movement to the political right, creating a more conservative approach to economics and social benefits. And many social programs were scaled back or eliminated. Crown corporations that provided things like electricity generation, oil distribution, and oil refining were sold off by the Canadian government in order to raise funds to pay down debt and to respond to social need. This kind of behavior, the selling off of assets, the divesting of certain kinds of practices to the market, continues today. What we talked about in the 1970s as the era of neoconservatism, we now talk about as neoliberalism. The goals, objectives, and practices of social policy are closely associated with theory. Each theory brings with it its own set of values and beliefs, and these values and beliefs are operationalized in the development and delivery of systems of social service. We're mostly concerned with neoliberalism at the present time, but we also need to talk about Keynesian economics, and there's some resources on Avenue for you to learn more about Keynesianism, and we'll talk about it more as we go along in the course. But remembering that each perspective, whether it's a gender-based perspective, a political economy model, a conservative approach that centers individualism, or a liberal humanist approach that says everyone has a right to a good life, each of these perspectives shapes the way in which we set goals for policy and we implement the practice of social work in the context of social policy. So many of the perspectives that we have introduced in our discussion of the British Poor Law remains consistent even in a contemporary context. There are particular ways in which we understand and organize the policies that we develop and the programs and services that we deliver. We still talk about means tests and needs tests. We still talk about deserving and undeserving. And if you've received any of the benefits related to COVID-19, then you know that you will experience the principle of lesser eligibility. We know that CERB, which is $2,000 a month, is just slightly less than the minimum wage. It's just slightly less than a pay-into program, an insurance-based program like UI, where you would receive about $2,104 a month if you were eligible for full benefits. So these kinds of approaches to providing social welfare services that still see that there are particular people who are understood as deserving and undeserving, and that people need to be motivated to go back to work. They're very much alive and present. To give you a few more examples, Ontario Works and ODSP bring to life the concept of the undeserving and the deserving poor. You receive much less money if you're on Ontario Works as a single person than you do on ODSP. And your access to resources and supports and your capacity to engage in work is more limited on Ontario Works than it is on ODSP. Lesser eligibility also presents itself when we think about employment insurance, EI, and the minimum wage. As I mentioned, the minimum wage is still more than employment insurance, and CERB is slightly less than EI. I left this slide in even though we'd already talked about it because I think it's a poignant reminder of the differences. Canada still has a few remaining universal programs, such as the child care benefit and health care. But we also have targeted programs that are designed to reach particular people within a demographic category, such as the child tax benefit, which is related to parental levels of income, and it's differentiated from province to province. Individuals placed in workhouses or almshouses had to engage in work tests to demonstrate their capacity to engage in work. Well, we don't ask somebody to break rocks with a hammer or to beat hemp into fiber so that we can weave cloth anymore. We do have work-related expectations. People on Ontario Works are expected to look for work and to provide work search evidence to their workers. People on EI are now expected to job seek on an ongoing basis, and after certain periods of time to take any work that is made available to them, unless the work is less than 60% of their previous wages. We also have things like WSIB, which is seen to be provided to people who are more deserving. Here, people have experienced a workplace injury, and so the employer, through the insurance program, are expected to retrain or to supplement the income of people who have experienced wage loss or wage gaps because of workplace injury. Many of the programs and services that are provided by government are provided as demo grants. They are payments to people who fit into particular demographic categories, often categories that are seen as vulnerable or in some way at risk. We provide a fair amount of money to young children under the age of 5 or under the age of 18, because we have a very low birth rate in Canada, and so we need to provide some resources to parents and kids in order to encourage people to keep having children. We also know that poverty can negatively affect the life chances and well-being of children, and so investing in kids at a young age will often reap rewards as they grow older and become adults. We also see older adults or people over the age of 65 as experiencing again some kind of vulnerability. With age comes frailty, perhaps, I don't know. But we do target some particular programs to seniors, particularly those who have experienced a low income as working adults and who therefore experience continued poverty in old age. The old age security is a pension that is provided to citizens who have resided in the country for at least 10 years, whether or not they have worked. So you may never have received paid wages for labor that you have sold in the market, but regardless of that, you will receive the old age security. The Canada pension, on the other hand, is something that people contribute to and draw from when they reach the age of 65 or 70 years. We also have programs that supplement the income of low-income seniors in order to ensure that they can purchase the necessities of life. In some cases, governments provide direct service to people, such as healthcare. You have to have someone who has some qualifications in order to receive good healthcare. So it makes sense for government to set up services that provide medical care directly to the population. In contrast, it sometimes makes more sense to provide people with tax rebates or other kinds of payments in order to allow them to purchase services or access resources in the community with those funds. So, for example, there are some tax-related benefits that students who attend school full-time may access. They pay up front for their tuition, books, and other things, and then can claim certain things for non-refundable tax credits at the back end. And a non-refundable tax credit means it's a credit towards taxes owing, but if you didn't pay anything into the tax system, you won't be able to draw anything out. You have to have a surplus at the end of non-refundable credits in order to get a refund. You notice that the course is called Social Policy Critical Frameworks. If you were taking this course 20 years ago, it might have been called Canadian Social Policy Critical Frameworks. But globalization has a significant influence on domestic social policy. Canada belongs to the UN and operates within the UN systems. We're expected to calculate our wealth and understand our well-being based on scales and assessments developed by the United Nations. We're concerned about things like GDP. We're concerned about things like population health. We're concerned about debt to GDP ratio, something that we'll want to concern ourselves with when we think about the funding for COVID-related programs. So the expectations of organizations like the UN and their sub-organizations like the World Health Organization, World Bank, and International Monetary Fund directly influence decisions made at the domestic level. So Trudeau is concerned with what the UN thinks about what we're doing. He's concerned about meeting targets. He's concerned about following their policy directives. And so many of the policies that we implement actually are spelled out at the UN level. And we'll look at some examples as the course goes on. Global processes directly shape national policies and benefits in a Canadian context. But it's the same all around the world. Whether you're in Ireland, Iran, or India, we're all influenced by globalization and the UN, and there are many policies that we implement in relationship to those things. Well, I hope this lecture has helped refresh your memory about some of the things that you already knew about social policy. I hope you can see how economic forces shape social policy, and I hope you've made some connections between the realities of the Great Depression and what's happening in a contemporary context with COVID-19. We're going to have more opportunities to think about this, but it certainly does raise some red flags, for me anyway, about what our government is doing and what's happening with the pandemic. I'll look forward to hearing your thoughts on these ideas on Flipgrid, and I'll look forward to connecting with you on Zoom when we all meet together. Take care.